Okay, so here are our last few structures for the skull. First, I wanted to show you the mandibular fossa, so let's get our bearings here. Here's our anterior view. Okay, and we're going to flip up so we have an inferior view. There's our styloid process again, we saw earlier, mastoid process. There's the external acoustic meatus. Okay, and here is the zygomatic process. Okay, so we'll start with from the external acoustic meatus, and see how there's this little ridge of bone? If you go just past that, you get to a depression on the surface of the bone that is right next to, just anterior to the styloid process. This is the mandibular fossa. Okay, and I'm going to grab the mandible so you can see how the mandible fits right into that location. Okay, so the mandibular condyle sits right in there. That's what allows you to have that nice hinge joint, okay, between the mandible and the temporal bone there. Okay, now the only other topic we have associated with the skull are the paranasal sinuses. Okay, and the paranasal sinuses are those spaces inside certain cranial and facial bones that make the skull lighter. They give us resonance chambers for speech, and they're all lined by mucous membrane, so this helps to warm, humidify, and moisten the air as we breathe it in. Okay, so there are 4 paranasal sinuses. The first one we'll do is this one here. This is the frontal sinus. Okay, and we're looking at a hemisected skull from a medial view. Let me give you the anterior view here quickly. Hello. Okay, there's our friend. Okay, and now we're going to turn and look at the medial section now. Okay, and so here we are right inside the frontal bone, so this is the frontal sinus. Okay, now the largest of the paranasal sinuses, again, let's get our orientation. Here's our anterior view, and I'm actually going to poke this probe here through the infraorbital foramen. We're going to see it in just a minute, so I'm going to turn it now. And look, there it is. Okay, and that's because we went right into the maxillary sinus through that opening. Okay, so the large opening inside the maxilla is the maxillary sinus. Okay, and those are the two that most people have trouble with, because if you get a sinus infection, you feel that pain and pressure in your forehead and inside your anterior face, and that's because you have material trapped in those spaces. Okay, now we also have a paranasal sinus associated with the sphenoid bone. Okay, and that's this big opening here, and you can see here's our sella turcica. Okay, so we know we're right in the sphenoid bone here. Okay, and then this set here, which is really pretty damaged actually in this specimen, but you can see that at one time there were lots of little compartments in here. This is where the ethmoid sinus would be. Many times the ethmoid sinus is referred to as the ethmoid air cells because it's actually a collection of multiple small sinuses. Okay, now the last bone we're going to do on this video is this bone, the hyoid bone. It's technically not a bone in the skull. It's also not a vertebral column bone, and it's also not a thoracic cage bone, but it is in the neck, so it's considered a bone of the axial skeleton. It looks like a little teeny tiny mandible, but it's not. It's the hyoid bone. Okay, and if you look at the skeletons in the A&P lab, the A&P1 lab, you'll see that it has no bony attachments at all to any other bone in the body. So on the skeletons, it has to be held on with wire. Okay, and this is an important bone that allows muscles to attach in the anterior neck that are important for speaking and swallowing.